Hello everyone, this is Ola. Welcome to part 4 of the endocrine physiology, and here we will talk about hormones, functions, and some hormonal disorders. Let's start with the pituitary gland and the growth hormone. Remember that the growth hormone is secreted by the pituitary gland after being stimulated by the hypothalamic growth hormone releasing hormone. The growth hormone stimulates the liver to release insulin-like growth factors that help growth of the cartilage. Also, the growth hormone increases the blood glucose and stimulates bone and muscle development and growth. So it's very important, especially during the childhood. But we don't need the growth hormone in a high amount. It has to be within range in a reasonable amount. And also, we don't need the growth hormone at the same level at every stage of our life. As we hit adulthood, we don't grow anymore. So we don't need high levels of the growth hormone. And here comes growth hormone, inhibitory hormone, which is somatostatin from the hypothalamus that inhibits the pituitary gland to produce growth hormone. How about if there is a disorder here and the growth hormone is released with high amount than needed during childhood? Then gigantism will develop. Gigantism is a disorder that has overproduction of the growth hormone during childhood as the epiphyseal plates are still active, and this can be caused by an anterior pituitary tumor. It can be genetically by a genetically mutated gene. So here the child will grow too much and will become of extraordinary height, sometimes up to 8 feet. The internal organs is going to be enormous, and the blood glucose increases so much, and this leads to diabetes. If the giant is not treated, he or she dies at an early age due to complication of diabetes and heart failure. That's gigantism. On the other hand, if we have excessive production of the growth hormone as we are adults during adulthood after closure of the epiphyseal plates, a condition that we call acromegaly develops. Here, the person will not be taller because the epiphyseal plates are now closed. What will happen is soft tissue swelling, resulting in enlargement of the hands, feet, nose, lips, ears, and there is a general thickening of the skin. So the person who has acromegaly will try to wear his shoes and they do not fit anymore because the feet are larger than before. Trying to put on the hat, but it does not fit anymore because of the expansion of the skull. And that soft tissue swelling of internal organs can lead to heart failure. This image of a 9 years old girl, and she's totally normal. And here, as she becomes 16 years old, she looks normal. But after this age, she got excessive production of the growth hormone and acromegaly. And here she is at the age of 33. So if you look at the nose, at the skull, they are larger than before. And here she is at the age of 52. You can see that the hands are larger, the skull is larger, the nose is larger. So this is acromegaly. On the other extreme, pituitary dwarfism happens due to insufficient production of growth hormone during childhood. So here, the child will be so short. We call that dwarf. This can be due to genetic causes, maybe tumor, maybe radiation, destroying the part of the pituitary that produces growth hormone. Injection of the growth hormone to the patient can bring about improvement, but not a normal state. But improvement happens if the treatment is received before closure of the epiphyseal plates. Then the child can get taller and improve somehow. The posterior pituitary gland produces two hormones that are originally made by the hypothalamus. They are the antidiuretic hormone, and this promotes absorption of water by the kidney. It's antidiuretic, means it prevents urination and water retention happens. The second hormone is oxytocin, and this stimulates uterine contractions during childbirth and also stimulates contraction of the breast ducts for milk ejection. Let's go with some review questions. Antidiuretic hormone and oxytocin are released by what gland? Posterior pituitary gland, but they are originally produced from the hypothalamus. What hormone stimulates uterine contraction during labor and milk ejection during lactation? This is oxytocin. Acromegaly is a condition that has excessive production of the growth hormone. When? During adulthood. Gigantism is also overproduction of growth hormone, but when? During childhood. Pituitary dwarfism is low production of the growth hormone when this is during childhood, before closure of the epiphyseal plates. The growth hormone target organs are fatty tissue, bone, and muscles.